and I'm glad to work with the Wisto Institute. Yeah, in this lecture, our lecture objectives by the end of the stick and psychodynamic approaches to psychology. These are just approaches to psychology, and by this lecture, you'll be able to do that. You'll be able to discuss the strengths and limitations of each approach. We are going to see that. You should also be able to see how these approaches are applied to health and illness. You see, the goal of us, the medical professionals, is to treat. We treat patients, and when it comes to areas of public health, we have preventive medicine. In other words, we offer preventive treatment. In other words, whether you cure, whether you prevent, you need to have an aspect of psychology to help your patients very well, or to help the communities very well. So we shall get started with defining the key terms. Generally, the key terms that we are going to face in this module, we are going to face psychology, we are going to see behavior, we are going to see mental processes. Beginning with psychology, just as a general term, it is the scientific study of human behavior and mental processes. Meaning, even if you are a teacher, even if you are a witchy type of worker, psychology, we study about human behavior and then mental processes. But when it comes now to health, to our department, we now continue and say to be able to treat our patients or and see how it is applied in health and illness, like that. When it comes to behavior, behavior refers to any observable action or response of an organism. You're seeing some examples there. How is this important in health? You see, we see very many patients. Usually, some of them can't even talk. Some of them can't even hear. But any patient that you're going to receive at your facility will have a certain kind of behavior that they are portraying to you. Yes, for example, an arm is shaking. An arm is shaking at a very rapid rate. Or the whole body. The whole body is shaking at a very rapid rate. For such cases, we call those ones convulsions. And the convulsions, the patient is not talking anything. The patient has not said anything. But because the body is shaking, meaning the body is undergoing convulsions. So for that case, as a healthy worker, how do you detect such a behavior? And how are you going to use it? So me, if I see the convulsions, I will consider this as a seizure. That's what we call a seizure, a generalized clonic tonic seizure. That is a term in mental health. And then what do you deduct in the end? I will say my patient has such type of a seizure and has a mental illness. But has the patient talked? No. The patient has just portrayed a certain type of behavior. We see patients who are going to cry in front of you. That's also a behavior that is portrayed by patients. So such cases, what do you take as the doctor behavior? You take the behavior and then make a deduction for that case. So this is how it can help us in healthy practice. Mental processes. We have these are the internal activities of the mind. Yes, thinking, feeling, or remembering. This is important in psychology and psychological assessment. For example, in the past 2 years, I've been working at a mental ward, and I could always test my patients using the days of the week. Can you speak the days of the week from Sunday coming back to Monday? In a way of Sunday, Saturday, Friday. Can a patient do that? If the patient can do that, meaning they have concentration, meaning they have a good memory, you get it. So that way, it's good at making diagnosis. Going to the next slide, the aim of psychology. Psychology aims to describe, explain, predict, and change behavior and mental processes using empirical evidence. And you can see in the goals of psychology, we have those goals as description, we have those goals as explanation, prediction, and then change. Description. This helps us to provide accurate and objective information about what people do and why they do it. Yes? description as the goal of psychology. What does this person do? And why ask their caretakers? Has he been doing this in the previous days? Yes. Has he done this in the previous days? When did this start? That's explanation as a goal of psychology. Prediction as another goal of psychology. We try to look at them. We look at their hairstyle. You look at their fingernails. You look at the type of clothes they are putting on. And you predict that such a case has lost taking care of themselves. Then perhaps this person has this type of condition. You get it? Change. Change as a goal of psychology. We try to apply psychological knowledge and skills, and we see how such people try to improve their well-being. For example, in smoking, is such a person able to undergo a behavioral change by stopping smoking? If such a person is able to detect that abnormality and then accept the change, then for such a case, psychology has achieved one of its goals. Going to the next slide. Before I proceed so further, can I just get a hi just to ensure that people are on? Just say hello or something. Just to ensure that we are following. Are we following?
Yes, we are.
Okay, that is great.
Yes, sir.
You see, in cases that is great.
I think
cases, our teacher
it's like network is breaking, eh?
Teach, and you only find out that he was speaking to himself. Yeah, but I guess we are following and we are trying it. Sorry? Yes? Oh, network have been breaking. How about now? Is it okay now?
Yes. I'm getting you somehow.
Is it okay now?
Somehow.
Yes? Okay.
Yeah, it is clear now.
Okay, it is clear now. Okay. It is just somehow. Let me first do like this here. Okay. So I guess
yes, it is clear.
Now. Okay. We have the main methods of psychology. The methods including observation, we have experimentation, correlation, and then questionnaire. These are the main methods of psychology. You might wonder, what do you mean by this? How do we, healthy workers, how do we use psychology? How do we use psychology to diagnose patients? Yes, these are the main methods of psychology. For example, observation. You look at your patient, you observe them systematically, try to measure their behavior and mental processes. Yes, try to give them, try to set them into controlled settings. You get it? There, that is observation. You try to observe their behavior. Give them tasks, give them assignments to do. You try to observe how does he react to such an assignment. Yes, and once you get their reaction to that, you can try to measure psychology, and that is observation. When it comes to experimentation, here you try to manipulate one or more variables and measure their effects on another variable. Telling him they are setting an experiment. So that is a method of psychology, and psychological assessment, experimentation. You get it? Now, another method is correlation. Here you try to correlation as you hear correlation, measuring, examining relationships. How is this factor related to this factor? So in correlation, here we measure a relationship between two or more variables, but we don't manipulate them. For this case, we don't get values of the search. In correlation, we just try to see how this factor is affected by another factor. Yes, and this also helps us in psychology and psychological assessment. We have also a case experimentation. Here, a questionnaire. Here you try to in case your patient can read or write, or in case they can hear and talk back, you try to select self-reported data from a number of participants using a questionnaire. You try to ask them questions. You ask questions while you take you fill a data form. Yes, and these questions give you an insight of their psychology. I guess we get that. So we have seen questionnaire, correlation, and then experimentation and observation as some of the methods as some of the main methods of psychology. We have very many other various methods for psychology and psychological assessment. How you can tell whether your patient has a proper mental function or not. Let's proceed to another slide. Now here we try to discuss the main approaches to psychology. Approaches to psychology. These are also how we can tell, how the various aspects in which psychology can be determined. For example, we have the biological approach, we have the behavioral approach. We are going to see each of these approaches. We have the psychodynamic approach, we have the cognitive approach. These are all approaches to psychology. Beginning with the biological approach, the biological approach to psychology focuses on the role of the nervous system, hormones, genes, and evolution in behavior and mental processes. Yes, the biological approach. In other words, the general body functioning, the physiology of the body, the general body functioning. Is the body functioning normally? For example, someone might have not been eating very well because they have digestive issues. Yes, these ones can also affect psychology. Someone has not been having proper physical exercise. People have been bedridden for a good number of days. People have been on the bed for a good number of days. So for such cases, biologically, are they functioning well? You get it? So this is what biological approach. That's to, this is what biological approach
Yes. If
shows that in psychology. You can see some of the hormones, genes, and then evolution in behavior and mental processes. Secondly, it says that behavior and mental processes can be explained by examining the physiological mechanisms underlying them. You know, physiology deals with functionality of the body. So, biological approach assumes that the physiological mechanisms, an example I gave, the digestion, the digestive system, the urinary system, that perhaps this person has kidney problems. That's why he is having a deviation in their behavior. Perhaps this person has an effect in the a certain effect in the liver. Maybe the liver is not functioning normally. That's why he's having some psychological issues. So these are the assumptions of this approach. Then thirdly, behavior and mental processes have adaptive functions that enhance survival and reproduction. This is also an assumption taken by the biological approach. I guess we are at here. Those are the assumptions. When we come to the strengths and the strengths and limitations of this approach. Strength, we mean how can we defend this approach that it is indeed true, this biological approach. Number one, it uses objective and precise methods such as the brain imaging, genetic testing, and hormone assays to measure behavior and mental processes. How does it do it? It finds out the concentration of these hormones in our bodies. We use biology to find out, does he have a lower concentration of estrogen? Does he have a lower concentration of testosterone? Those are reproductive hormones. Perhaps when we go to the thyroid hormones, does he have a lower or higher concentration of the thyroid hormones? You know, when we have a higher concentration, that is hyperthyroidism. Such a condition, it causes enlargement of the thyroid gland, and for that case, someone will have a bulge around their neck because the thyroid gland has enlarged. You get it? So for such enlargement of the thyroid gland, perhaps biology says that that's why he's having a deviation in their behavior to mental processes. What we are trying to get at the strengths. These are some of the factors which defend the biological approach. Second, it provides a scientific basis for understanding the biological causes and treatment of psychological disease. One is too fearful. You exist in fear. In fear of something. We shall see these terms as they are used among individuals and groups based on genetic and environmental factors. Like I've told you, these are some of the things which defend the biological approach to psychology. When we go to the limitations, these are some of the things which might not defend the biological approach or which count it off. For example, it may neglect the role of psychological, social, and cultural factors in behavior and mental processes. You see, the psychological and the social factors are very much important in behavior. For example, in child development, the environment in which the child grows or develops determines a lot in their behavior. But now, this biological approach, it tends to neglect
Hello guys, it's like the lecturer has gone offline, eh?
Yeah, it seems here. Even the network was cutting, so anyway.
Yeah, the network is so bad. Dennis,
Yes,
I came late. How far have you people gone with the lectures? I only met the methods of psychology.
yeah, we didn't go far. I think we joined just when we have started. So it was just started actually few minutes when I joined. So the methods,
Okay,
the definition, nothing much. Yeah.
it's okay.
See, it focuses on the role of the nervous system, hormones, and genes, and evolution in behavioral and the mental processes. You see, this approach to psychology, for it uses chemical substances, for example, hormones, enzymes, and these genes. It uses these chemical substances to assess psychology. In other words, we use these approaches in psychological assessment. That's the role of these approaches. However, the biological approach, for it uses chemical substances. It uses the biochemical substances. For example, the hormones, you're seeing them there. The genes, you can see them. The enzymes, these are the chemical substances that it uses. If I can proceed by giving another example, we measure concentration of the hormones. The hormones such as the testosterone, the thyroid hormones, the estrogen. We measure those chemicals, the concentration of those hormones, and it tell whether this person is functioning psychologically, is functioning normally in their psychology, to tell whether there is a deviation in their behavior. For example, if an individual is producing more of testosterone in men, testosterone usually determines sexuality. Perhaps they can have a higher sexual function. Or if an individual produces a lower level of testosterone, meaning they have sexual dysfunction, and sexual dysfunction is a huge psychological abnormality. And so biological approach measures the level of those chemicals to assess psychology. Assumptions. The biological approach assumes that behavior and mental health processes are influenced by biological factors such as the neurotransmitters, hormones. I think that point is now understandable. When it measures the level of those substances, for it assumes that once you measure the level of these substances, you can know the behavior and mental levels of such a patient or an individual. Secondly, it assumes that behavior and mental processes can be explained by examining the physiological mechanisms underlying them of the behavioral approach. Is in a way that physiology means functionality. We know that. Yes. So it assumes that if you try to examine how various body systems function, it assumes that you can know the behavior of such an individual. Thirdly, it assumes that behavior and mental processes have adaptive functions that enhance survival. We get it, that enhance survival and reproduction. Strengths of this approach, these are some of the factors that define the biological approach. Strengths, it uses objective and precise methods, for example, brain imaging, genetic testing, hormone assays. Like I've said, it tries to measure the levels of these chemical substances to tell a deviation in behavior. That's a strength that defines this approach. Secondly, it provides a scientific basis for understanding the biological causes and the treatments of psychological disorders. For example, schizophrenia, depression, anxiety. Anxiety means fear. Depression causes an individual not to be settled. I guess we know depression and how it occurs. Schizophrenia means that you perceive the environment in a different way from what other normal people perceive it. I guess we get that. We shall see these things when we look at abnormal psychology. Schizophrenia, what you perceive from the environment is different from what other people perceive it to be. Yes. And then another strength is that it accounts for similarities and differences in behavior and mental processes among individuals and groups based on the genetic and environmental factors. In other words, the information it gives, we can easily retrieve it. We can easily trust it. Yes. Limitations of this biological approach. It may neglect the role of psychological and cultural factors in behavior and mental processes. This means that it may neglect the environment in which the child developed from, in which we the human beings exist in. It neglects the fact that we grow in different environments. We grow with the different people around us. Some people grow up with their parents, some people don't grow up with them. That is now the cultural and the social concept. Biological approach tends to neglect them. And then, secondly, it may reduce complex human phenomena to simple biological explanations. This means that we have a lot of we have factors in the human behavior that are complex, but biological approach tends to underlook them, tends to go to just to explain them in a simple way. If I can give an example, in the psychiatric wards, in the mental wards, individuals present with the grown up hair, which is not even cared before. Such an individual, biological, such a case, such a presentation, such a presentation of grown up hair that is not cared before, indicates that this individual has the mental problems. But what biological approach tells us, it might tell us that perhaps this individual forgot to comb the hair, and thereby we neglect such a presentation. Thirdly, it may raise ethical issues regarding use of animals in research, genetic engineering, and neural enhancement. For such a case, you see, in experiments, we don't use human beings. We instead use animals. And it is ethics which defend humans being used in experiments. If you use of course, we cannot use humans, and it uses animals to explain a behavior that happens in human beings. I guess we get that. So that becomes a limitation. It doesn't really. It doesn't. Animals have different behavior from human beings, but biological approach uses the animals in experiments to show what happens in human beings. So there, it becomes a limitation of this biological approach. Applications of this approach in health. It can be applied by understanding the physiological aspects of health, which helps in developing interventions and the treatment. For example, we develop medications that target neurotransmitters. We develop medications that target chemical mediators, for example, adrenaline. We develop medications that target different enzymes, and all other cases. So that's an application of the biological approach. Just as a check, I want to confirm that we are together. I'm seeing a hand being risen up by Unzimai. Unzimai, your hand is up.
Yes, it is fine. I read that one before.
Oh, okay.
That was earlier one.
Okay, so we can continue.
Yes, yes.
Okay then. Proceeding to the cognitive approach to psychology. The cognitive approach to psychology focuses on the role of mental processes such as perception, attention, memory, reasoning. You see, I will pull out reasoning and then memory and perception, because these three terms, perception, memory, and then reasoning, they give details of cognition. How do you reason? Can you keep information? Can you retrieve information that you kept? Information on what happened yesterday, on what happened last week. Perception. What do you perceive from an event that has happened? You get it? So these aspects of psychology, cognition, the cognitive aspects of psychology are the factors that the cognitive approach focuses on. Problem solving, decision making, creativity. These are all aspects of the cognitive approach. So, assumptions. The cognitive approach assumes that behavior and mental processes are influenced by cognitive factors. For example, mental representations, information processing, and cognitive biases. That's an assumption that the cognitive approach assumes. Cognitive approach also assumes that behavior and mental processes can be explained by examining mental operations that underlie them. For example, the way you behave as an individual, and then which mental operation is connected to your behavior. For example, thinking, reasoning, memory. We look at the fact that what you have, the way you have behaved, has it ever happened before? And then we see whether it is connected to memory. Does it occur because you are remembering something? Does it occur because you are thinking of something? That's also an assumption of the cognitive approach. Another assumption is that behavior and mental processes can be improved by enhancing cognitive skills and strategies. That's also an assumption that the cognitive approach takes. When we proceed to the strength of the cognitive approach. I guess we are on. I've tried to put in a slideshow mode. That's where I've tried to put. The strength of this approach is that it uses rigorous and controlled methods such as experiments and computer simulations, artificial intelligence, and cognitive neuroscience to measure behavior. We saw in the behavioral approach, for it uses chemical substances in the body, it uses neurotransmitters to measure psychology, to measure behavior. But this one uses the we try to test how you reason. We try to test how you approach to something. Those are some of the experiments we perform here. We try to test whether you can remember, whether you can concentrate. For example, me when I'm at the mental ward, when I'm working at the mental ward, my patients that I receive, always before doing anything, what I first ask them to do is to tell for me the days of the week in a reverse direction. To tell for me the months of the year in the reverse direction. There, I'm trying to test their cognition, their concentration. I'm trying to test how can they concentrate on something. That is all testing for cognition. Usually, I ask the names of their children. I ask the names of their parents. There I'm testing for memory. You get it? So for such cases, I'm assessing using the cognitive approach. It provides a comprehensive framework for understanding the cognitive aspects of various psychological phenomena such as learning, intelligence, personality, emotion, motivation. In other words, it focuses on personalities of on different people's personalities to tell their behavior. Personality, are you short-tempered? Those are all personalities. How is your temper? Are you when you get disturbed, how do you react? That's all considering personality, and that is a strength that cognitive approach lies on. Another strength is that it applies cognitive principles and techniques to help people cope up with psychological problems such as phobias, stress, and depression. In other words, we subject someone to remembering something. In case you're fearful, in case you're depressed, someone is undergoing stress, we can try to bring something that can bring joy to them. We can make them remember something that brings about state. Stress, free from depression. Limitations of the cognitive approach. The cognitive approach may ignore the role of biological emotional and motivational factors in behavior. In other words, you see, we saw the biological approach, and it told us that chemical mediators can cause a deviation in psychology. Yes, but the cognitive approach tends to neglect that chemical mediators can cause a deviation. I gave you an example of the testosterone hormone. In case you have lower levels of it, we saw that it can cause sexual dysfunction. Cognitive approach tends to show you that such cases are not so much important in psychological assessment. That becomes a limitation in now. Secondly, it may overemphasize the rationality and objectivity of human cognition and underestimate the influence of emotions and context. Yes. Like we saw that for it focuses on cognitive aspects. For example, reasoning, it focuses on perception, memory, but it tends to neglect that people have emotional imbalances. We have those cases whereby someone tells you, I'm not in the mood. I feel like I'm not in mood. I feel like doing this and this. Such cases, such emotional changes. Now the cognitive approach tends to neglect those. We know emotional changes can so much determine our behavior. So much determine the way we think, the way we reason. They can make you to forget something. Now, such emotional changes, if they make you to forget something, however, the cognitive approach, since it focuses on memory, if you forget something, it will say your memory is weak. Yet, there is a case of emotion that might have caused you to forget something. That becomes a limitation. Thirdly, it may rely on artificial tasks and stimuli that do not reflect real life situations. For example, this aspect that I've told you, I make my people to first list for me the days of the week in a reverse direction, the month of the year. Such things actually they are hard to apply in real life. They're not applied so much in real life situations. Someone can ask you what is the importance of this. You get it? Yes. So it may rely on tasks, such tasks like this one I've just told you, tasks that do not reflect real life situations. However, you might ask me that, Master, isn't that important then? It is important, but it is only important when you have combined it with other methods of assessment. You get it? In that, if you tell someone to list for you those number of days, yes, if someone fails, don't base on that to assess their psychology. Consider other factors. Proceed to consider on their appearance. You get it? Yeah. How can we apply the cognitive approach in health? We see that cognitive interventions focus on changing thought patterns. For example, this can involve addressing cognitive distortions related to illness, pain, or stress, which promotes mental well-being. We look at when we focus on reasoning as one of the cognition aspects of psychology. How does reasoning affect? How does reasoning determine the changing patterns in thinking? If you have ample time for reasoning, it also favors the thinking. Yes, so cognitive interventions focus on changing thought patterns, and here we can address illness, we can address pain, we can address stress. Yes, these are some of the things that we do in guidance and counseling. People come to us when they have, for example, they are HIV positive. Yes, such people, you subject them to remembering something, to remember their goals of life. Some people have goals, that if I die, I must drive this type of car. Such goals, we make these individuals to remember those goals, and they learn how to live positively with HIV. And other cases, that is cognition. The behavioral approach to psychology. This is behavior. This is behavior. The behavioral approach to psychology focuses on the role of learning, reinforcement, and punishment in behavior and mental processes. In other words, reward and punishment. Usually, there is an example of this man Ivan Pavlov. I know you might have heard of him, who performed an experiment on a dog. He set up a reward and punishment. He set up a stimulus response experiment. When he could ring the bell, and then the dog starts salivating because the bell could indicate that food is ready. So these are all behavioral aspects of psychology. Reward and punishment. Usually our animals at home, if you want to train it, the cats, the petties, if you want to train it to be that you something that we can set up something in that plate, that the day that animal eats from that plate, do this again. Or in case it does something good, you put a reward. Yes, and such cases, these are all behavioral approaches to psychology. When we try to get the assumptions of this approach, the behavioral approach assumes that behavior and mental processes are influenced by environmental factors such as stimuli, response, and consequences. What you set up for the environment, it assumes that such environmental factors so much influence an individual's behavior. It also assumes that behavior and mental processes can be explained by examining the observable and measurable associations between them. When we try to examine and to observe and measure associations between stimulus and between stimuli and their responses. An individual, for example, we, the human beings, are used to eat lunch. By 1 p.m. you're eating lunch. So what if a moment happens and you don't eat lunch at that time? You know what happens? You start feeling stomach ache, you start claiming of ulcers, you get it. So such cases, this approach assumes that behavior and mental processes can be examined by examining the observable and measurable associations. It also assumes that behavior and mental processes can be modified by changing the environment contingencies that control them, in a way that if we change an environment from which an individual has been growing up or developing from, we change it will also change response to that, to the changed environment. That's an assumption of the behavioral approach. In other words, people who smoke, for example, what if we try to limit import and export of cigarette? We are trying to change an environment. Will this individual try to change their behavior and leave smoking alone? That's what we are trying. This approach is trying to look at. People who take alcohol. What if we deny them money to buy this alcohol? How will their behavior change? Yes, that's what this approach tries to assume, as in such a case. Strengths of this approach: it uses objective and empirical methods, for example, observation, experimentation, behavioral analysis to measure behavior and mental processes. We have seen how different approaches measure their behavior. We have seen. It provides a clear and testable explanation of how behavior and mental processes are acquired, maintained, and changed through learning. I've given an example of this of the Pavlov's experiment. Conditioning. The dog was trained and learned that whenever the bell is rung, it's time for food. How did it respond? It salivated. Such an experiment is proven even on us human beings. You try to set yourself to having lunch. You set yourself to having lunch whenever time for lunch comes about. Another strength is that it applies behavioral principles and techniques to help people overcome psychological problems such as addiction, obsessive compulsive disorders, or autism, behavior. This approach here, it is telling us that you can use the behavioral approach to make an individual adjust in their behavior. For example, having daily physical exercises, sleeping under mosquito net, regulating alcoholism, and all other cases. These are all aspects of behavioral approach that we can use to change behavior and hence influence people's health. When we go to the limitations of this approach, may neglect the role of cognitive, biological, and emotional factors in behavior and mental processes. It may neglect the fact that people have different memory and reasoning capacities. For example, me, I enter a community as a healthy worker, and I find out that this community has a general condition of obesity. This community is almost affected by obesity, and what happens is that I wanted to cause a behavioral change to make these individuals attend aerobic sessions each and every evening. I want to set up a case whereby these individuals in this community are going to have physical exercise of a minimum of 30 minutes per day. But a limitation stands in the way that these people have different personalities. These people have different reasoning capacities. These people have different perception capacities. You will say something that members, please let us start having physical exercises. Some will listen to you and others will see you as if, now what is he talking about? Well, you remember in COVID-19, vaccinations, the Ministry of Health all across the world, the World Health Organization was encouraging people to go for vaccination. But some people could go there willingly, but others were being pushed to go. You get it? So such a case, behavioral approach does not focus that people have different cognitive and biological factors. We get it? Yes. Another case is that it may underestimate the influence of free will, personality, and individual differences in behavior and mental processes. In other words, people have different choices to make capacities, have different decision-making capacities. Yes, and an individual chooses to do something, or an individual chooses not to do it. So behavioral approach does not focus on that. It assumes that all members will respond to what you're saying. Yet we can say this stands as a limitation. It may raise ethical issues regarding the use of reinforcement, punishment, and then behavioral modification. For example, you want to make your animal, or you want to make human beings learn something new, but you are using the approach of reward and punishment. If you use that aspect of reward and punishment, whereby if an individual does this, you punish them. If an individual does this, you reward them. That aspect of punishment, it is unethical, because you're punishing someone not at their free will, but and they have not even consented. You get it? So it is unethical, and the behavioral approach that becomes a limitation to it. For example, in a community whereby you want to introduce aerobics and physical exercises, this community might be having a good number of people who are a bit lame, but you get it. But behavioral approach, it says that don't consider the other factors which don't. I think we are now good at behavioral interventions. And remember, please, We are public health officers, we are midwives, we are nurses, we are reproductive health officers. We all need psychology to foster health very well, or in our health practice. We get it, eh? Yes. Behavioral changes. All your patients who come to your facility, as they are leaving, you will need to provide them with some supportive treatment. And supportive treatment here is behavioral change. Adhesion to medication, adhesion to drugs. We have patients who have poor adherence to drugs, whereby someone does not take the drugs in their required doses. You get it, eh? Yes. So you will want to cause that behavioral change, and they become adherent to medication. In other words, all of us will need such approaches in our health practice. The humanistic approach to psychology. The humanistic approach focuses on the role of self-actualization, personal growth, and human potential in behavior and mental processes. This focuses on us, the human beings. We do things depending on what we feel like. I do something depending on my life, my personal goals. I do something depending on my personal norms, my personal values. You get it, eh? That is the humanistic approach, and for it, that's how it approaches psychology. The main assumptions of this approach are that behavior and mental processes are influenced by personal factors such as values, beliefs, goals, and self-concept. I've just talked about this. It assumes that behavior and mental processes can be explained by examining the subjective and the unique experiences of each individual. What have you gone through in your life? What has happened in your life as you were growing up? Such experiences, it assumes that such experiences shape the behavior we, the individuals, go through. For example, people in certain areas, such as you have been hearing of cases in Ukraine, wars. A lot of wars have been going on. Imagine children who are growing through such environments, such experiences. How will they behave in the future? That's an assumption taken up by the humanistic approach. Behavior and mental processes can be enhanced by fostering a positive and supportive environment that allows people to express themselves freely and authentically. This assumption can be based on the fact that if you want your child to be a footballer, that's a supportive environment. Provide a supportive environment, provide balls to play with them. You want your child to be, for example, an engineer. What environment are you putting around as a supportive environment for such a child to develop in line with engineering? I think we can see these things happening in daily life. That the environment you provide a child as he or she is developing determines a lot in their behavior, and that's an assumption by the humanistic approach. Strengths. What are the strengths and limitations of this approach? What does it rely on? It relies on the fact that it uses qualitative and holistic methods such as interviews, case studies, and self-reports to measure behavior and mental processes. These case studies, self-reports, and interviews, we shall see more details when we are discussing research. As we are beginning, I told you I'm going to be taking you through psychology and research methods. Yeah, so we shall see more of the case studies, interviews, questionnaires. We are going to see everything in details, and we shall enjoy even. Another strength is that it provides a positive and optimistic view of human nature and emphasizes the inherent worth and dignity of each person. What do you take yourself to be? What do you consider good to your side? How do you take yourself? Are you a border rider? Are you a healthy worker? Do you take yourself as a common person? Do you take yourself as a person of low dignity? What do you take yourself to be? the humanistic approach provides this view, and that stands to be a strength. And indeed, what people take themselves to be determines a lot in their behavior. We get it, eh? What you take yourself to be determines a lot in how you behave. You take yourself as some person of low dignity. You take yourself as a healthy worker. You get it, eh? Yeah. Thirdly, as a strength, it implies humanistic principles and techniques to help people achieve personal fulfillment, happiness, and well-being. Of course, humanistic principles here we mean the goals, the norms, the values. What do you take as your values of life? What are some of the things that you want to achieve in life? You get it, eh? Yeah. Such principles that determine a lot in fulfillment of human well-being, eh? And that is the strength of this humanistic approach. Limitations. It may lack scientific rigor and validity as it relies on subjective and self-reported data that are difficult to verify and analyze. For example, the humanistic approach, we are going to find out, perhaps we may find out what are your goals. We might even ask you, what are your goals of life? What do you want to achieve in life? And you will tell us. But again, we don't know whether you have lied or not. There's no way we can prove that. There's no way we can prove that this person is of this dignity. However much we can tell that his dignity is of a high dignity. We can tell from perhaps the way you dress, the way you speak, you get it. But there's no confirmation. There's no way we can confirm that this is actually the way you behave. You get it? We just tell from the way we see you. So that becomes a limitation of this approach, because it cannot be experimented. You get it? Yeah. Another limitation is that it may be too idealistic and naive, as it ignores the negative and destructive aspects of human behavior and mental processes. We as the people who are assessing your psychology, we might be having some ideas, but we cannot have any. We cannot try to generate any information of how you developed from childhood. Yes, a child is going to come from Ukraine, as I used an example, and comes to your country and perhaps comes to your neighborhood. Yes, and such a child is going through certain behavior which is not good. Yes, such a child is brought to your health facility, and you're trying to assess this child according to how you see him or her. But there is some history behind in his development, that his country had an attack from another country, or his country had wars by the time this child was developing. You get it? But you as a healthy worker, you are naive. You have no information of what happened in this childhood's life during development. So this becomes a limitation of the humanistic approach. We have said that it focuses on you, the human being. You get it? Yeah. Another limitation is that it may be too individualistic and relativistic, as it disregards the role of social norms, values, and expectations in behavior and mental processes. This means that we have aspects by we expect you as a normal human being to be behaving like this. You get it? For example, abusing other individuals, and dressing from the public. You get it? We don't expect you to. And dressing is okay. Yes, and dressing is okay, but so long as you're doing it in your own room. You get it? Or in a private area. You get it? But where are you undressing from? You get it? So those are the normal behaviors, normal expectations in the society. You get it? Now, the humanistic approach does not focus on those normal expectations of you, the human being, of how you are supposed to behave. You get it? That becomes a limitation, in a way that for it focuses on you, the individuals, on we just ask yourself, perhaps he's a night dancer. Maybe he's a night dancer. That's why we are seeing him undressing. Oh, perhaps he's that's what he likes. That's what he feels like. You get it? Eh? That's now a limitation of the humanistic approach. Eh? It focuses on the fact that maybe he's behaving like this because he doesn't know the truth. Eh? You know, we have those people who say like that me I did it, I was stealing, I'm a thief because I don't know whether theft is bad. You get it? Eh? Some people can say like that. Me, I don't know whether it is bad. You get it? Eh? So, humanistic approach has that limitation. It does not focus on what is expected as a normal human being, the way you are expected to behave. However, it focuses on that that's what you like, that's what you feel like. You get it? Eh? That's what your goals tell you, and other things in line with that. I guess we are together. When we proceed to another approach that becomes the psychodynamic approach, we are trying to get to an end of our today's lecture, and perhaps if this is our last approach to look at in psychology, the psychodynamic approach. This approach focuses on the role of unconscious forces, conflicts, and motives in behavior and mental processes. In other words, it focuses on on things we do when perhaps we don't know. Okay, we might knowing, but the situation has forced me to do it. For example, poverty. We have people. I'll use the theft as well as an example. In line with poverty, someone will go to steal not because they want, but because they are poor. There are other things which happen. We have the unconscious forces that push us to do them. You do it involuntarily. Sometimes when you don't even know that you have done it, you get it. Yeah, that's what the psychodynamic approach to psychology tends to tell us. The main assumptions, it assumes that behavior and mental processes are influenced by unconscious factors such as instincts, drivers, complexes, and defense mechanisms. Defense mechanisms, for example, we shall look at the ego in our the ego, the ID, the superego. We're going to look at such mechanisms in our coming lectures. Defense mechanisms, you do something trying to avoid trying to avoid something. That's an assumption of the psychodynamic approach, and we have already seen that for it says psychology or behavior are driven by unconscious factors. Unconscious factors are those factors that we do involuntarily. You're not conscious that you're doing it. You get it? Yeah. Another assumption is that behavior and mental processes can be improved by resolving unconscious conflicts that cause psychological distress. I think that is understandable, as in it is related to the previous point. It assumes that when you adjust unconscious conflicts, you will be able to improve behavior. Another assumption is that it assumes that behavior and mental processes can be explained by examining dynamic interactions between the ID, the ego, the superego. These are three aspects of defense mechanisms. We shall see them. And another one, by examining the conscious, the preconscious, the unconscious, reality principles, and other aspects. You are seeing them. Displacement, rationalization, regression, yes, fixation, all stages. We have the stages of development, all stages, anophalic stages, all these stages. The psychodynamic approach assumes that if you examine all these aspects of psychology, you can easily explain an individual's behavior. We shall see when we will focus on one by one. We shall see whether you can really use them to explain why individuals behave the way they behave. The strengths of this approach is that it uses in-depth and exploratory methods such as psychoanalysis, free association, dream analysis, projective tests, transference, counter-transference, and other aspects, insight, catharsis, working through. It can use them to measure behavior and mental processes. Yes, we are those aspects you're seeing there. Those are some of the factors the psychodynamic approach uses in assessment, in psychological assessment. We have seen how each approach, how it assesses psychology, psychological assessment. How do we tell the level or the state of the psychology of an individual? Is this individual psychologically okay? Yes. Is this individual functioning normally mentally? Why is he behaving like this? All those factors. We have seen how we can assess psychology using these approaches, and the psychodynamic approach. This is also the way it assesses psychology. Going to another strength, it provides a rich and comprehensive account of the psychological development and functioning of each individual. The psychodynamic approach, for it now, it will focus. It focuses on how a child has been developing from childhood. We get it, but psychologically, it focuses on what has been his environment. As you have received this child from Ukraine in your health facility in your country, that you will use the psychodynamic approach to tell this child which environment did he grow through. Did he grow with his parents? Was he cared for? Was he breastfed well? How was his birth? Was it by a cesarean section? Was it by a push? All these things, all these aspects, they influence behavior. However, it is the psychodynamic approach that will provide an account of how this child developed. Another strength is that it applies psychodynamic principles and techniques to help people cope with the psychological problems such as neurosis, personality disorders, and relationships. Yes, and when we go to the limitations of the psychodynamic approach, it is limited in a way that it may lack scientific rigor and validity, as it relies on unobservable and unfalsifiable concepts that are difficult to test and verify. In other words, you cannot subject an experiment. You cannot subject an experiment to prove whether this child this child grew up from a country which had very many wars. You cannot prove that. You get it? Yes, that is what we mean by lack of scientific rigor. You cannot prove the information you obtain from psychodynamic approach. It may be too deterministic and pessimistic, as it assumes that human behavior and mental processes are largely controlled by irrational and unconscious forces that originate from childhood experience. Yeah, I've talked about childhood experiences, but I can talk more on unconscious forces. It's a limitation in a way that if I tell you that you're behaving the way you behave because you don't know whether it is good or bad, really, that's the limitation of this psychodynamic approach. People behave the way they behave because they know why they are behaving like that. Well, we have individuals in communities who behave because they don't know whether the way they're behaving is good or bad. But that is the least percentage of such individuals in the community. Yes? Yeah, so it's a limitation because psychodynamic approach relies on that fact that behavior is determined by unconscious forces. Yes, we can also tell that yes, we have unconscious forces that can determine the behavior, but we cannot rely on it. Yeah, we also have conscious forces that determine behavior. Another limitation is that it may be too sexist and culture bound, as it reflects the biases and values of its founder, Sigmund Freud. Sigmund Freud, we shall talk about him when we are looking at the personalities in psychology. He was a male European from a patriarchal society. We shall look at him when we are looking at the personalities in psychology. A limitation it has here on the cultural bound. It focuses so much on the area from which you grew up. Yeah. However much this child I've been using as an example, this child who grew up from Ukraine. Yes, Ukraine is a country, was a country of wars. Perhaps by the time it grew up from this child grew up from a country which had wars. By the time this child grew up, grew up, but you might not necessarily rely on that fact. You might not necessarily rely on that fact that because this country had the wars, because this country had insecurity, you cannot rely on the fact that perhaps this child is, that's the reason why he behaves like that. So you're not sure whether it is really the causative factor to this child's behavior. So that's what we meant by this point being a limitation of the psychodynamic approach. This marks the end of our lecture for today. I guess when I changed it to another device, I guess now things have been clear. I guess we have tried to understand these approaches, because if you understand these approaches very well, our succeeding lectures are going to be very easy to understand. Yes, so I'll get in touch with the coordinator and try to share my slides so that you can receive them and read. Yes, please, when I give the slides, try to read and understand, because we shall be having some sessions of assessment and examination to see whether you can apply these approaches in health and illness management. I beg to stop here unless there is any question somewhere, or any, perhaps since this is my first time to meet you or to have a lecture with you, you can also say something that, Master, perhaps you were a bit speedy, or this and this. So I welcome any idea. Yeah, you can. In case there is nothing, you can also say, Master, the thing is the case has been okay. Yes, Florence, I see your hand is up.
Yes, thank you very much. I don't know, your name is Charles, or it's because you changed your device?
Yeah, I changed the device actually. My name is Kato Alex Mare. My name is
okay, thank
Alex.
you very much. Okay, thank you very much, sir. It was really so nice, and I really enjoyed it. However, the speed is a little bit fast. That is according to me. So at least next time, maybe you can go slowly. It will be okay to me. Thank you very much. Otherwise, it was so nice.
Okay. Thank you so much, Florence. That has been noted. Yeah, I mentioned it because I realized I was a bit speedy. Yes, Dennis, I see your hand is up. Dennis.
Yes, sir. I think my hand remained up since that time. Otherwise,
Yeah, it has been up
for
since
that,
the lecture.
yeah. Otherwise, thank you so much for the lecture has been nice. I think as Florence put on the speed, but I think we pick a lot of things. So everything tends to be under control. So I think next time it will be better. Thank you, sir.
Okay, thank you so much, Dennis. Thank you so much. Perhaps, do we have any colleague here who is a midwife, who is studying midwifery? Anyone who's studying midwifery here? Or anyone who is studying public health? Anyone who is studying reproductive health here? Reproductive health. Florence, which course are you studying? Which course are you doing?
Nursing.
Oh, you're in nursing. Then Dennis?
Same.
Oh, you're also in nursing, eh? Okay.
Yeah.
That is great. I think we are going to be discussing a lot we shall be discussing also a lot in research, and we shall be helping each other there. We will I introduced myself at the beginning. I'm a public health officer and I'm a researcher. I'm an official researcher, so shall be helping each other in line with that. Otherwise, thank you so much, the host of this meeting, Mr. Sam, and yeah, I hope we can close the lecture at this moment in time, and I hope we shall meet tomorrow. Have a good time.
Okay, thank you, sir. You can share for us maybe your slides too, so that we can also do some research a bit of it. Thank
Okay,
you.
that is okay. I've shared the slides with the coordinator, Mr. Sam. I've shared the slides with him, and he will share with you so that you read further, and you can also use them in future references.
Okay, thank you.
Okay, have a nice time.
Thank you.
You too.
But I think that this